could talk a little bit perhaps about tummy tucks as we started out with the liposuction, some things we may not have hit in reference to tummy tucks.
Well, tummy tucks are a spectrum of operations, and kind of the simplest way to think of it is how big will the scar be when you're done, and where's the problem. If the problem is muscle laxity as well as skin and fat, a tummy tuck's a great operation. We see a picture here where we see again on the left the pre-op and then post-op. We can kind of see the scar post-op around just above the bathing suit line there and around the belly button. In this patient, we went ahead and tightened the muscle, as well as by sort of pulling downward in front, we're able to get rid of the extra skin and some of the extra fat. And this scar, you can see, sort of extends around towards the back to try and also help with some of the hip roll type of problems that people have. Now, if we take a tummy tuck and we extend that and do what we call a circumferential abdominoplasty or tummy tuck, we're literally taking that scar completely around, kind of like a belt. So sometimes people use the term belt lipectomy. And that just means taking it all the way around. You can get a little bit of a buttock lift, and we sort of see an example here. You can see how kind of in the back hip roll areas things are much tighter, and although this picture doesn't quite do it justice, the butt's been lifted up a little bit. So in some ways it kind of combines the tummy tuck with the butt lift in the back and gets rid of the hip rolls. And again, it's a great operation, a lot more recovery than just a straightforward tummy tuck, more scar than just a straightforward tummy tuck. But for the right patient who sort of has the problems, particularly around the sides and the back, this is a great thing to add to a standard tummy tuck.
And when you look at statistically the surgeries, are most people concerned about what they look like from the front versus what they look like from the back?
You know, everybody's a little bit different. You know, it's funny what bothers one person about themselves that some people couldn't care less about. So the danger I run when someone walks in and, you know, I point out something, I've got to make sure they also see it as a problem. So it takes a lot of listening as to what their primary interests are. When I look at the difference that most people are looking for is they want to feel good in their clothes, their summer clothes particularly, or in bathing suits. Scars can be hidden if placed in the right spot by underwear and by bikinis and things like that. So they're more concerned with how am I going to look in my clothes, and the scars that come around the back to help achieve a tighter contour and a tighter waist are a real good trade-off for those folks. Now you can take that circumferential tummy tuck one step further, and you can actually do some work down on the outer thighs and get a lot of lift for the saddlebags. And that, again, that's a fantastic operation, but your recovery is again more, and it's more discomfort. And with all of these operations, tummy tuck and liposuction, you do have to worry about things like blood clots, and I think that's sort of from a medical standpoint, we're really appreciating the dangers with that across the board, whether it's plastic surgery or orthopedic surgery. So early mobilization and making sure folks will get up and understand the importance is really important. There's even some folks we put on sort of mild blood thinners to try and minimize the risk if we really feel like they're high risk. So that's, again, all part of the conversations I think are critical for folks to have long before they have surgery.
We have Renee waiting for us on the phone lines with the question. Hi, Renee.
Hi. I had a question. I had twins, and they were early, so I got kind of big, but I didn't get any stretch marks, and I started out at 105 pounds. My max before they were born was 127 pounds, and I'm 105 pounds now, and the only thing that happened to my body was my stomach just has some extra skin, but you can only tell when I, push the sides together. Okay. And I was wondering if there was something I could do just naturally for that. I do have good muscle tone underneath it.
Sure. I mean, it sounds like you'd be a great candidate just to get rid of the extra skin. There's something called a mini tummy tuck, where for folks whose muscle's in good shape and their belly button's in the right spot and it's just a little extra skin, maybe some stretch marks, we can just simply remove that extra skin from the belly button down. You know, it's funny, I'll have some patients come in, you know, that are twigs really thin, and they'll bend over and say, see, look at all this extra skin. You know, I guess if we all push hard enough, we can find some. But I could take a look at that with you and show you what we could do and not do, and what I think would be effective. The fact that you only gained 20-some pounds in a pregnancy, especially with twins, is a little bit on the low gaining side, so I hope all the twins are doing okay. But I wouldn't expect with 20-pound weight gain in pregnancy for it to have affected your muscles a whole lot. So it may just be a skin operation for you.
Thanks for your call, Renee. Judy's up next. Hi, Judy.
Hi, I was wondering if you do, it's called a thread lift for plastic surgery, like for a cosmetic lift, and if you do, like some idea of what the cost would be and how long the recovery is?
Well, what you're talking about is a technique for facelifting where they took these special kind of sutures that had barbs on them, just like fishing hooks, and they sort of would thread them in certain directions called vectors to get lifts to the tissue. There was probably 5 courses being offered at my national meeting that's coming up, and the FDA put the kibosh on that technique and said we're not going to approve these sutures, and all those courses were canceled. So I'm not sure that you can actually get a thread lift right now and not be in, or as a doctor, that I cannot be in certain violations with sort of FDA and or some regulatory body. So I would caution you right now about having that done, because what they're finding, and I think this is the concern, is those sutures are permanent, and we're now seeing, after a couple of years of doing this, that people are having problems with infection in those retained sutures because they are a foreign body. They do offer, I think it's a nice alternative for someone who, at least in concept, who didn't want the big facelift operation with the incision in front of the ears and behind. But I guess I'm a little leery about its long-term effects, particularly now when I'm seeing that the FDA is not approving the suture. I would caution anybody from pursuing that, at least till this sorts out.
I want to thank you so much for being with us tonight. We're actually out of time, so thanks
Thank
again.
you.